Assalamu alaikum. Welcome to tonight's episode of Talking Point. I'm your host Syed Neaz Ahmed. Today in our studios we have Dr. Professor Arup Ratan Choudhury. He is a senior consultant and professor of dentistry at Bardem in Dhaka. He also collaborates with World Health Organization Collaboration Center in Bangladesh Institute of Research and Rehabilitation in Diabetes. Previously and also currently, I understand, he has been producing programs, presenting programs on health matters on television and radio in Bangladesh. He attended Dhaka Medical College, later University of London and the State University of New York. Welcome to the show, Dr. Arup. How are you?
Very good. Thank you very much.
What brings you to London this time? We have met before.
Yeah, of course. I remember that. This time I came to Manchester for attend and present my paper in the 12th Oral and Dental Health Congress.
Right.
So I was a speaker. I did some research in Bardem Hospital.
Right.
Because you know that I work in such a hospital. All the medically compromised patients are admitted there, like diabetes, heart disease, renal failure, stroke patients are there. Even the pregnant women, those that have got diabetes. So I deal with them. So I know how to manage this compromised patient to take care of their oral health.
Right.
So my paper mainly on this, and I talked about this matter, how to manage dental health with the compromised patients. It's a delicate one because one should have some skilled and also some training, special training.
You must have collected a lot of data.
Yeah, of course. That I presented this time in the meeting.
How did it go?
Very good. Everybody was very much interested. Most of the participants were enthusiastic about the speech, and they asked me a lot of questions. Because they deal with this kind of patients every now and then. And you know, Bangladesh Diabetic Hospital is a WHO collaborating center. And we are doing a lot of works on these compromised patients. We are doing a lot of research.
Well, what was your finding? What was the end product of your research?
End product of the lecture is that dental health is a very important aspect or should get priority for the diabetic prevention, not only for the diabetic management and heart disease prevention, heart disease management.
Because this is the gateway.
This is the gateway. This is the right thing that you have mentioned. And if the oral health is very bad, if there is a focus of infection in the mouth, that goes directly to the heart by blood circulation. So one should have a good dental health if they want to prevent diabetes and also to prevent heart disease. And also not only this, the thing is, if anybody has diabetes, if he want to make a good control of diabetes, it is not necessary that he should take more insulin, do more exercise, do diet control only. If his mouth is infected, his lot of periodontal disease, teeth is infected, then that also hampers to control diabetes. So you have to be ensured about that. You are going to dentist every 6 months. Have a visit and do the dental treatment. Whatever
that is good for the dentist also, isn't it?
Making money. So we are appreciating to encourage people to come to the dentist to prevent lot of dental diseases like oral cancer. You know, Bangladesh and in Southeast Asia, oral cancer is a very popular and common disease. And you know, the tobacco use, smoking is also very high in our country.
And isn't it true that a lot of people ignore or rather they do not take that much of care of oral health?
Yes, it is very neglected. In Europe, America, there is a system that you should go to a dentist regularly. Every 6 months.
Even the dentist will call you after 6 months, you have not come.
Yeah, they send a letter. And once upon a time, it was known that birthday once a year, dentist twice a year.
So these days, that is not just dentist, it's the optician.
Yeah.
And also again now, it is that one of the very famous companies, I will not name them, they deal in pharmaceuticals, they are providing they test your hearing for free.
Yeah.
Once a year.
Once a year, yeah. And the another thing is, if you do not go to dentist and examine your teeth regularly, your teeth, the primary stage of dental caries will be much more complicated.
True.
Then you need root canal treatment, then you need crown bridges, that is more expensive.
Right.
So if you want to prevent disease, not only to cut down the cost of the dental treatment, you must go to the dentist regularly.
Why is it famous? I mean, I'm jumping some of the stages, but why is it famous? Come to my mind that orthodontists and normal dentists, see, they're so expensive. Even in Bangladeshis background, see. Why is it so?
Because these are all cosmetic treatment, and the cosmetic treatments are never free in any country, even not in America.
True.
Their national health.
Not even here, no.
Not even here in America.
In exceptional circumstances, like accidents and all.
This is not that you cannot survive without this treatment.
Right.
That's why government keep low priority to this kind of treatment, because you look fine, you look nice, and you can have a beautiful smile.
Right.
That is up to you. You can go to dentist to make your smile more beautiful.
Yep.
You can make some correction with the orthodontist.
Right.
That's why this is expensive, one. And secondly, the materials that are using in the dentistry, the cosmetic dentistry, is also expensive.
Right.
So that's why it is expensive.
In Bangladesh context, do we produce our own materials or we get it from abroad?
We are producing nowadays some of these materials, but not that all are. But most of the materials are coming from abroad.
Right.
Yes. China, Europe, America.
Is it comparatively, is it cheaper in Bangladesh than here?
It is more cheaper because most of the patients from Europe, America coming to me every year, not only visiting Bangladesh but also visiting dentist. They said, I come to Bangladesh for 2 months, 1 month for dentist, 1 month for my relative.
Well, even in the East European countries, they're having roaring businesses. They're attracting patients from London. They're offering round-trip tickets, and it's much cheaper as they advertise.
Really?
Yes, it's much cheaper. I'm not comparing the prices in Dhaka, but here what is prevalent here. See.
No, we are providing good treatment nowadays because our equipments, our skillness, our experience, our foreign training is much more higher than the before.
Professor, you have been involved in a lot of things, not just dentistry, but as a social worker. Last year in 2015, it was a recognition of your social services towards drug abuse and drug addiction that the government of the People's Republic of Bangladesh awarded you with a Kushe Padak.
Yes.
Congratulations on that.
Thank you very much.
And we are so proud that we have somebody here. We have had occasions of brilliance here, and we have had, alhamdulillah, Oscar winners and Nobel laureates and all that, but alhamdulillah. Now, how did you get into this? You have an organization, you established that, I think, in sometime in 1982 or something?
Yeah.
See, Manas, M-A-N-A-S,
yes. Because you see, I went to America in 1987 for a training and the fellowship on drug abuse and how to prevent drug abuse and drug prevention programs. So, government has invited me to visit a United States. It was under the United States International Visitors Program. That was firstly, it was an invitation from the American Cultural Center to see how to control drug abuse and how to give rehabilitation and treatment and prevention. So I went to many states in America, like in New York, Minnesota, Minneapolis, San Diego, and New Jersey, and also in Orlando, Florida. So they have shown me how to build a rehabilitation center for the drug addicts.
Right.
And I have seen a lot of things that drug addiction is a social problem, and people suffering a lot of these things, and this is a disease, and one should get treatment.
Right.
And you need complete full course of treatment, that is counseling, detoxification, full rehabilitation. And that came to my mind that Bangladesh is not much advanced in this respect. So when I came back from America in 1987, in 1989, I formed my Manos, this organization, and I started working on this. And I with some of my friends, some of the vocal artists like Sabine Yasmin, Anjana Sultana, and Atkare Kibriya, Ferdous Wahid, Shubin Nandi, all of them are in our organizations because they are celebrities. And when we are going to every school and colleges, everybody was very much interested to hear something from our people, our group. So we made the speech on drug addiction. And then we performed some music so that they can listen, they can get some awareness, they can get some preventive the works so that they can get themselves herself ready to control themselves from drug addiction. So this is the way we started our organization doing NGO program. Now we have got so many branches in Bangladesh, so many districts. We are trying to make some video films, some regular books, leaflet, posters that we are distributing to every school colleges. Last year we produced a film, as you have mentioned last year in my interview, that was known as Swargo Theke Norok, Heaven to Hell. How a drug addict family is suffer from a drug addict child.
Yes, it's not just him, it's the entire family.
Our entire family is suffering for one person. So my film is based on how to cope with this problem, how parents will deal with this child.
Don't look down, but try to solve it.
Yes, not punishing him, not kicking him, not doing him anything, but you have to accept that this is one kind of disease that he has got, like diabetes. If he has got diabetes, you should go to the doctor, needs some counseling, needs some treatment. Drug addicts also need some treatment, counseling. So this is the film that we made, and if any parents can see this film, they can understand how to cope with this problem. And not only this, after treatment, this problem child can be rehabilitated in the society, and he can work against drug addiction. So this is the story.
How rampant is drug addiction in Bangladesh?
It's growing. You know, once upon a time, the fancy deal was very much popular in our country, and you know, the India border, all fancy deals are coming. Although it is a cup syrup.
You will probably know it correctly. Somebody said that along the borders there are 350 factories producing fentanyl to be exported into Bangladesh.
But recently Bangladesh and Indian government has jointly, they have a meeting and they stopped this.
Great.
This is a great news. They have stopped it and no more this kind of fentanyl is coming. But still now somebody is making, it is coming. But Yaba is now very popular in Bangladesh.
Easy to transport too.
Transport, yes, because it's a small tablet. You can keep it in anywhere in your pocket or in your jeep or in your box. And it is coming from Myanmar now. So this is another problem. Now Bangladesh government, Home Ministry and our Director General of Drug Control, they are doing programs with the Myanmar.
Okay, we'll have to take a break here.
Okay, sure.
And when we come back, we'll definitely pick up the thread and we'll go to the Myanmar border.
Okay.
Thank you very much for being with us, and don't go away, we'll take a short break, and when we come back, we will still be with Dr. Arup Ratan Choudhury.